Right now, somewhere between your knee and your doctor's next available appointment, a decision is being made about the rest of your walking life, and you weren't even in the room for it. Have you been told your knee is bone on bone? Has a doctor already said the word surgery like it's not really a question anymore, just a date to pick? If you're nodding, stop for 1 second because you need to hear this. You may not need to make that decision today. And if you do the next 15 minutes right, you may never need to make it at all. Here's something almost nobody tells you clearly. Two people can walk into the same clinic, get the same x-ray, hear the exact same words, bone on bone, no cartilage left, and one of them is in daily pain, wincing on every stair, while the other is out walking the dog before breakfast without a limp. Same joint, same damage on paper, completely different lives. If the damage on the film were the whole story, that couldn't happen. So what's actually deciding who hurts and who doesn't? I'm going to answer that. And then I'm going to show you something most knee content never touches. Not just what muscles to strengthen in general, but exactly where your knee is losing the fight, and how to protect it in the specific moments that matter most, hundreds of times a day, not just for 10 minutes on a mat. By the end, you'll have a simple daily system that hands you real evidence, not a guess, not hope, about whether surgery even belongs on the table right now. I'm the host here at Senior Leg Health, and this is exactly the kind of thing we dig into every week. So let's get into it. Start with the part your x-ray was never built to show you. The cartilage inside your knee, that smooth cushion sitting between the bones, doesn't have nerve endings that feel pain. Let that land for a second. It can wear down almost completely and never send a single pain signal on its own. So where is the pain actually coming from? From the tissue around it, the lining inside the joint, the tendons, the small nerves in the bone underneath, getting hammered because the muscles that are supposed to guard that area have gone quiet and weak. When those muscles are doing their job, they act like a shock absorber, soaking up the force long before it ever reaches the damaged part of the joint. When they're not doing their job, none of that force gets absorbed at all. It travels straight through, unfiltered, and lands directly on the spot that's already worn thin. That's the real answer to our question. Two identical x-rays, two different lives, because it was never just about how much damage was sitting there. It's about how much of your body weight is actually landing on that damaged spot, step after step, hour after hour, for years on end without you ever noticing. Now, if you've spent any time looking into this already, you've probably heard the standard advice. Strengthen your glutes. Try a wall sit. Practice standing up with better form. I want to say this clearly. That advice isn't wrong. It's a real, legitimate place to start, and if you've already been doing it, good, keep it up. Nothing you're about to hear replaces that foundation. But here's what that advice almost never tells you. It hands you one instruction and assumes it fits every knee the same way. It doesn't. Your knee has its own specific weak point, and until you know exactly where that is, you're strengthening in the dark, hoping the effort lands somewhere useful. And here's the bigger miss. That basic advice usually stops at, do this for 10 minutes a day. But your knee isn't loaded wrong for 10 minutes a day. It's loaded, correctly or badly, every time you stand up, turn around, or take a step, hundreds of times before lunch, and thousands more before you go to sleep. 10 minutes of exercise, no matter how well done, can't outmuscle hundreds of badly loaded moments happening the other 23 hours and 50 minutes of your day. So today, we're going past the basic version, straight into the part that actually closes that gap. We start not with an exercise, but with a question your body already knows the answer to. You just haven't asked it yet. Stand next to a counter or a sturdy chair, close enough to grab it, feet about hip-width apart. Now slowly rock your weight from your right foot to your left, back and forth, slow and easy, like you're testing the ground beneath you. As you shift, watch your knees. Does one of them dip inward, just slightly, a beat before the other? Does one side feel planted and sure, while the other feels like it's negotiating with the floor, searching for something solid to hold on to? That small wobble is telling you something real. Whichever side gives first is the side where your muscles are losing the argument with gravity. That's your weak side. That's exactly where the load is sneaking through, quietly, every single day. Here's why this one small check matters so much. Almost every knee video hands you a single instruction and expects it to work identically for everyone, as if every knee wears out the same way. It doesn't. But if your left knee is the one struggling, and you pour all your effort into your right side, you're fixing a problem you don't actually have, and wondering months later why nothing changed. Finding your own pattern first is what makes everything else from here actually count, instead of guessing blindly. One quick caution before we go further. Hold on to something solid the entire time you try this. We're not testing your limits, we're just listening to your body. Keep a hand on that counter, and if you feel unsteady at any point, stop, and check with your doctor or physical therapist first if balance is already a concern for you, or if your knee pain is severe. This is a gentle awareness check, not a workout, and it should never feel risky. Now that you know which side needs the work, here's the skill almost nobody teaches, because you can't exactly carry a mirror around all day, watching your own knee every time you move through your kitchen or down your hallway. So instead of watching it, you're going to feel it. Stand normally, weight even on both feet. Notice where the pressure sits under each foot, more toward the inside edge, near your big toe, or more toward the outside edge, near your little toe. For most people whose knee tends to cave inward, which lines up with that inner, more heavily loaded side of the joint, the pressure quietly drifts toward the inside edge of the foot without them ever realizing it. Now try this. Gently press down through the outside edge, as if you're trying to grip the floor with the outer edge of your foot, spreading your toes just slightly. Watch what happens to your knee. For most people, it shifts outward on its own, into better alignment, almost like the body was simply waiting for permission to do it correctly. That feeling, pressure sliding to the outer edge of your foot, is your new signal. Something you can check anywhere without anyone noticing. Standing at the sink, waiting in line at the pharmacy, walking to the mailbox. No mirror, no one watching, no pausing what you're doing. You just check in with your foot for half a second and let it steer your knee back into a safer line. This is the piece the basic exercises always skip. They tell you what good alignment is supposed to look like, but never once tell you how to actually feel your way into it without staring at yourself in a mirror that isn't there. And that's exactly why some people do the standard routine faithfully for weeks and still feel stuck, still frustrated, still wondering if any of it is working. They're building strength in the right muscles, but never learning to apply that strength where it actually counts. Real life, in real time, without thinking twice about it. Which brings us to the biggest gap of all, and honestly, the part that changes the most. Think about how many times a day you deliberately, carefully stand up or sit down, the way a structured exercise might teach you to. A handful, maybe. Now think about how many times your knee gets loaded without you thinking about it at all. Moments nobody ever flagged as a problem because nobody ever pointed a camera at them or thought they mattered enough to mention. 3 of these moments matter more than almost anything else because they happen fast, constantly, before you have time to think. The first is getting out of bed. Most people swing their legs off the edge and push straight up off the mattress using whichever leg happens to be doing the work, often the weaker one, simply because it's closer to the edge or because it's habit. Instead, before you push up, take half a second to find that outer edge pressure on both feet and rise slowly, letting both legs share the load evenly instead of lunging up in one quick, uneven motion. That first movement of your day sets the tone for how your knee behaves for the next hour, and honestly, the rest of the morning. The second is turning while standing still, at the sink, at the stove, reaching across the counter for something just out of reach. This one is sneaky because you're not exercising, you're just living your normal life, so nobody ever thinks to check their knee here. When you twist your upper body while your feet stay glued to the floor, your knee absorbs a rotating, twisting force it was never built to handle, especially on your weaker side. The fix is simple. When you need to turn, let your feet turn with you. Pick them up and pivot toward whatever you're reaching for, instead of twisting through the knee while your feet stay planted like they're stuck in cement. And the third is stepping down, off a curb, down a single stair, off a low step in the garden or a porch. This is often the hardest single moment for a struggling me, because your entire body weight lands through a bent joint all at once, with almost nothing to slow it down or spread the impact out. Here's the refinement. Before you step down, find that outer foot pressure on your standing leg first. Then lower yourself slowly, letting that leg control the descent like a brake, instead of letting gravity simply drop you onto the lower foot. If there's a railing nearby, use it, every time, no exceptions, no matter how confident you feel that particular day. Getting out of bed, turning at the counter, stepping down. 3 ordinary moments repeated dozens of times a day, and every single one is a chance to either protect the damaged part of your knee or quietly wear it down a little further without ever knowing it's happening. This is the layer basic routines never mention, because they're built around a 10-minute session on a mat, not around your actual lived day. Now here's something that has nothing to do with muscles at all, and almost nobody brings it up, even though it affects every step you take. Go look at the bottoms of your shoes, the ones you actually wear most around the house or outside. Are the heels worn down unevenly on one side? Is the sole thin, flat, with almost no give left in it at all? And think about the floors you spend the most time standing on: hard tile, bare concrete in the garage, a firm kitchen floor with no cushioning underfoot. These things matter more than people realize, because before your muscles ever get a chance to absorb anything, your foot has already made contact with the ground. Worn shoes and unforgiving floors send more of that shock straight up into your knee before any of the work you're doing even has a chance to help you. This won't fix a damaged joint on its own. It's not a cure, but it removes one more force working against everything else you're building, quietly, in the background, every single day. And it costs you nothing but 5 minutes and a look in your closet. So let's bring all of this together into something you can actually track, because good intentions fade fast the moment nothing is being measured. Here's how you turn this into a real, honest test of where you stand. Each day for the next 2 weeks, take 30 seconds in the morning for your weight shift check, so you always know which side needs your attention that day, because it can shift slightly from day to day depending on how you slept or how active you were the day before. Throughout the day, stay alert for your 3 key moments: getting up, turning, stepping down. And each night before you go to sleep, write down one thing, not everything. One specific moment where you caught yourself about to load your knee the old, careless way, and corrected it in real time using your outer foot cue. One catch, every day, written down, even if it's just a single sentence in a notebook by your bed. Why does this matter more than simply tracking how your knee feels day to day? Because it isn't passive. You're not just waiting 2 weeks and hoping for the best, the way a lot of advice quietly expects you to. You're actively building a skill and proving to yourself in writing that you're using it in real moments, not just in theory. After 14 days, if your log is full of real catches, moments you noticed and corrected, and your knee genuinely feels steadier, more dependable, less unpredictable, that's strong evidence a conservative approach deserves more time before surgery becomes the next step. And if, after 2 honest weeks, your log stays thin and nothing has meaningfully changed, that's useful too. It tells you and your doctor exactly where to look next: your footwear, your flooring, whether a physical therapist needs to check your form directly, hands-on, or whether the joint has simply progressed past the point where this approach alone can carry you. Either way, you walk into that conversation with real information instead of just fear and a scheduled date. I want to be honest with you about something, because I'd rather you trust this than be impressed by it. There's real research showing structured exercise programs can meaningfully close the gap in pain outcomes between exercise alone and surgery, for a real portion of people with severe knee arthritis. That's genuinely encouraging, and it's worth knowing. But it's not a guarantee, and your situation is your own. How much damage you actually have, your overall health, your own body's history, all of it plays a role in how this goes for you specifically. This isn't a promise that you'll avoid surgery forever, and anyone who promises you that isn't being honest with you. It's a real, evidence-backed reason to try the more precise version of this approach first, and let your own body tell you, with real data, what it actually needs. Let me give you a picture of what this can look like in practice. Picture a woman in her late 60s, a composite of stories we've heard, not one specific person, who'd been told she needed a knee replacement within the year and had already started dreading the recovery. She started with the weight shift check and discovered her right knee was the one giving way, not the left, which genuinely surprised her because the right side wasn't even the one that ached the most during the day. For 2 weeks, she caught herself at the sink, on the stairs, getting out of bed, correcting through her foot instead of forcing her knee the way she always had without thinking. By the end, she wasn't cured, and she wants people to know that clearly. But she was steadier. Her log was full, page after page of small catches, and she walked back into her doctor's office with something solid and specific to say, instead of a vague feeling and a resigned shrug. That's the whole point here. Not a promise that the damage disappears, a way to find out, with real evidence gathered by your own hand, exactly how much control you actually still have over how this feels day to day. So let's come back to where we started. You came into this with a diagnosis sitting on a piece of film, bone on bone, cartilage loss, maybe even a date already circled on a calendar somewhere in your kitchen. That image describes what a machine saw in one frozen moment, under one set of conditions, on one particular day. It does not describe what your body is capable of once you learn to protect it, moment by moment, choice by choice, all day long, for the rest of your life. Here's your starting point, and it takes less time than reading this sentence took. Today, do the weight shift check and find your weaker side. Tomorrow, start applying the outer foot pressure cue at your 3 key moments, getting up, turning, stepping down. And tonight, before you turn off the light, write down your first catch. That's how this begins, not with a surgery date, with one small, honest observation about your own body. If this changed how you see your own knee, I want to know, which side surprised you when you did the weight shift check? The one that already hurt? Or the other one nobody suspected? Tell us in the comments below. And if you've already been doing the basic exercises for a while now, tell us honestly. Did they help? Did you plateau? Or did nothing really change no matter how consistent you were? I read these, and your answer might be exactly what someone else scrolling through tonight needs to see. If you found this useful, give it a like. It genuinely helps this reach someone else who's staring at the same diagnosis you were an hour ago. And send it to someone who's been told they need knee surgery and doesn't know there's a more precise way to try first. If you want more real, practical ways to protect your legs, rebuild your balance, and stay steady and independent for years to come, subscribe to Senior Leg Health. We're here every week with exactly this kind of guidance. No fluff, no fear-mongering, just what actually helps. Your knees have carried you this far, through every version of your life so far. Now you know a smarter, more precise way to carry them forward.